We measure heart rate, blood pressure, risk scores. But what if we also measured joy? I notice it every time I walk into a clinic. A space filled with laughter and warmth feels different than one that's sterile and silent. Is joy measurable? And can public health systems be designed to foster it intentionally? Me? Before we dive in, the views expressed on Tomorrow's Consciousness podcast are for informational purposes only and aren't professional advice. Always consult a qualified expert about your own situation. This could be a strengths-based future conversation. Public health tends to focus on preventing harm, but behavioral change research shows that positive reinforcement, reward, and meaning drive better outcomes, relevant for hospitals, clinics, digital health tools, and policy environments. Let's look at trauma-informed care, health in all policies, and patient experience movements. Let's look at the science of joy and how it impacts immunity, longevity, and recovery. Cultural inequities in access to joy and leisure linked to racism, poverty, labor policy, behavioral interventions that increase well-being in health systems, designing joyful clinics, joyful discharge planning, etc. Public health leaders who are piloting joy-centered models, what they're learning. Imagine a hospital room filled not just with medical equipment, but with laughter, art, and moments of genuine connection. Across the country, health systems are reimagining patient care by putting joy at the center. Meet Maria, a stroke survivor, daily music sessions, visits from therapy dogs, and a care team trained to celebrate every small victory. According to her nurses, Maria's spirit lifted. Her recovery milestones arrived sooner than predicted. Stories like hers echo the research. When patients experience joy, their bodies respond. Immune cells become more active, stress hormones drop, and healing accelerates. Healthcare providers are taking note. Some clinics now design colorful, sunlit spaces and encourage creative expression as part of treatment. Others organize joy rounds, where staff share uplifting stories to boost morale for everyone. These real-world examples show that joy isn't just a feel-good concept. It's a critical component of healing. By weaving joy into the fabric of healthcare, we're not only treating illness, but nurturing the whole person. And as more health systems adopt this approach, the science of joy transforms from data on a page into lives changed for the better. We've established that joy is a powerful biological force, a key ingredient for a healthy life, capable of rewiring our brains and strengthening our bodies. But this raises a critical and deeply uncomfortable question we can't ignore. If joy is so healing, if it's as essential to our well-being as clean water or nutritious food, why do we tolerate a world where it's a luxury for some and an impossibility for others? The hard truth is joy is not distributed equally. Across our communities, a profound joy gap persists, a chasm separating those who have easy, daily access to moments of delight, connection, and safety from those who don't. This isn't a matter of chance. It's a direct result of deeply entrenched societal barriers. Consider systemic racism. Through decades of discriminatory housing policies, underfunded public services, and over-policing, it has intentionally created environments of chronic stress, not celebration. Think about poverty, which forces a relentless, draining focus on pure survival. When you're struggling to pay rent and put food on the table, where is the time, the energy, or the mental space for leisure, for hobbies, for the simple, restorative pleasure of being with loved ones? And trauma, both the acute trauma of individual experience and the collective historical trauma carried by entire communities, locks the nervous system in a state of high alert. It steals the feeling of safety that is the absolute bedrock of joy, leaving behind a landscape of hypervigilance. Add to that the epidemic of burnout. It's the exhaustion of essential workers, the depletion of community leaders, the quiet desperation of feeling constantly overwhelmed by a world that demands too much. For many, joy isn't just scarce, it is structurally denied. Behavioral scientists and public health experts call this structural joy deprivation. The structural part is key. It clarifies that the absence of joy isn't a personal failing or a negative attitude. It is the predictable, measurable outcome of systems, policies, and physical environments designed without human flourishing in mind. And make no mistake, this is a public health crisis hiding in plain sight, a social determinant of health that directly contributes to higher rates of depression, heart disease, and chronic inflammation. Conversely, the research from fields as diverse as urban planning and neuroscience converges on a powerful conclusion. Environments built for joy predict not just happiness, but healthier people. Think of safe parks, walkable streets, and vibrant public spaces. These aren't just amenities, they are public health infrastructure. They encourage physical activity, foster social connection that combats loneliness, and reduce chronic stress, leading to measurably better health outcomes. But not every neighborhood is gifted these resources. In some places, joy is woven into the fabric of daily life. In others, it remains a distant, almost unimaginable hope. To understand the real-world impact, take the crisis in Black maternal health. For decades, Black mothers have faced alarmingly higher rates of complications and mortality. This isn't biology, it's the physiological toll of navigating a healthcare system with documented bias and living in a society that imposes a chronic weathering stress on Black bodies. But today, the powerful movement for birth justice is fighting back by reclaiming joy as an act of resistance and a tool for survival. They are creating solutions that center dignity and delight. Community doulas provide continuous emotional and physical support, buffering against the stress of the hospital environment. Culturally rooted birthing centers offer care that respects tradition and lived experience. And joyful rituals, from belly blessing ceremonies to postpartum celebrations, are being revitalized. These interventions are proving that fostering joy and reducing stress can directly lead to better birth outcomes, helping mothers and babies to thrive, not just survive. Their message is clear. Everyone deserves joy, especially in life's most vulnerable moments. Or consider the profound impact of green spaces. Leah. A landmark 2019 study found that people who spent just 2 hours a week in nature reported substantially better health and psychological well-being. This access is linked to higher levels of physical activity, more social connection, and lower rates of chronic disease. The evidence is so strong that some healthcare leaders are now pioneering nature prescriptions, directing patients to spend time in parks as a formal part of their treatment plan. These examples prove that joy isn't a frivolous feeling. It is a fundamental human right and a critical determinant of public health. And it's a right we can actively build into the fabric of our society. We can by mandating that urban planners, architects, and policymakers prioritize parks, public art, and community gathering spaces. We can, as citizens, organizers, and health professionals, demanding policy changes and budget allocations that fund the infrastructure of joy. And we must, safeguarding existing community assets from neglect and gentrification. By shining a light on the joy gap, we see the barriers, but we also see the incredible possibilities. This is the new frontier for public health and healthcare leadership. It's about looking beyond the clinic walls and recognizing that the most effective prescription might not be a pill, but a park. It's about understanding that when we invest in joy, we are making the most fundamental investment of all. We invest in health equity, creating the conditions where everyone has a fair and just opportunity to be healthy. We invest in dignity, affirming the value and worth of every single person. And we invest in hope, building a future where the chance for a joyful, vibrant life is not a privilege, but a universal right. What if joy wasn't an accident, a fleeting moment left entirely to chance? What if it was a deliberate choice, a foundational element carefully woven into the very fabric of the systems that shape our lives? We move through a world of systems every day: hospitals, transit networks, community centers, public parks. Too often, these spaces are designed purely for efficiency, for function, for managing problems. They can feel sterile, anonymous, and even anxiety-inducing. But they don't have to be. We can design an architecture of emotion, creating environments that don't just serve our physical needs, but also nourish our spirits. This isn't about ignoring hardship or pretending pain doesn't exist. It's about recognizing that joy is not a luxury, it is a vital, functional component of human flourishing and a powerful catalyst for healing. Think pediatric spaces with Pixar lobby energy, not DMV vibes. For visionary leaders in health and community spaces, the conversation is shifting. The question is no longer why should we focus on joy? The evidence for its importance is overwhelming. The real pressing question is how do we build it in? How do we operationalize joy? In a world of tight budgets, staffing shortages, and immense pressure to meet clinical targets, focusing on an emotion can feel like a soft and secondary goal. But this is a profound misunderstanding. Designing for joy is one of the hardest, most strategic moves a leader can make. It delivers a powerful return on joy. When people feel seen, valued, and uplifted, patient satisfaction scores climb, but more importantly, trust is forged. Staff burnout rates decrease and retention improves. And most critically, clinical outcomes get better. It's a strategic imperative disguised as a feeling. Leaders aim for Ted Lasso level kindness, coaching joy daily. The journey begins with a simple yet revolutionary tool, the Joy Audit. This is far more than a suggestion box or a single question survey. It's a systematic, empathetic investigation of the entire human experience within a system. The first step is to map the journey. From the moment a person first interacts with your organization, be it a confusing website, a long phone hold time, or a welcoming front door, to their final follow-up appointment. We identify the joy deserts, those moments of friction, anxiety, or invisibility that drain emotional energy. And we uncover the joy oases, the small, often unintentional moments of connection and warmth that already exist. Imagine clinics that don't just measure pain on a scale of 1 to 10, but also ask, when did you last feel a moment of joy or comfort here? Or what part of your visit felt the easiest today? These questions, gathered through observation, interviews, and thoughtful surveys, can provide a completely new dataset. They start a new conversation, one that moves beyond simply treating a condition and begins to center the patient's full emotional and human experience. With these insights in hand, co-design becomes the engine for transformation. This isn't a top-down process where executives guess what people want. It's a deeply collaborative and creative practice. We invite the true experts into the room. The patients who navigate the system's complexities, the families who bear witness to their struggles and triumphs, and the frontline staff, the nurses, receptionists, and custodians, who live and breathe the system's reality every single day. In these workshops, we don't just talk, we build. We use storyboards to visualize new care journeys. We create low-fidelity prototypes of new spaces or communication tools, and we role-play interactions to test their emotional impact. By bringing these diverse voices together, we empower them to become architects of their own experience, shaping joyful, dignified, and truly helpful moments all across the care journey. Nowhere is this more tangible than in pediatric hospitals. Here, the abstract idea of joy becomes concrete. We see art-filled corridors and playful waiting rooms that do more than distract. They actively transform anxiety into curiosity and laughter. But it goes deeper. MRI machines are redesigned as submarines or spaceships, turning a terrifying procedure into an adventure and dramatically reducing the need for sedation. Interactive healing gardens on rooftops provide a vital escape. Even staff uniforms are rethought to be less clinical and more approachable. The result is not just a nicer building, it's a measurable reduction in patient and family trauma, fostering an environment where children can focus on what they do best, healing and being kids. At the other end of life spectrum, in hospice and end-of-life care, the focus shifts from cure to comfort, from duration to dignity. Here, joy is found in meaning and connection. Music therapy isn't just background noise. It's a therapist playing a song from a patient's wedding day, unlocking a flood of precious memories. Memory rooms are carefully curated spaces, filled not with medical equipment, but with photographs, favorite books, and personal keepsakes that tell the story of a life well lived. We see legacy projects where patients record their stories for their grandchildren, and sensory therapies that recreate the smell of a favorite flower or the taste of a cherished family recipe. These interventions offer profound comfort, turning a time of fear and uncertainty into a period of peace, reflection, and connection. And this thinking must extend beyond the walls of our clinics and hospitals, because health is created in our communities. Public spaces are a critical piece of our social infrastructure. Think about parks, plazas, and even bus stops. When designed with intention, they become powerful engines for public health. It's not just about adding a bench. It's about applying principles of biophilic design, incorporating vibrant colors, natural light, and abundant greenery that fulfill our innate need to connect with nature. It's about installing interactive art like musical swings that encourage strangers to play together, or creating community gardens that foster social bonds and provide access to fresh food. These spaces invite people to pause, to connect with one another, and to feel alive, reducing the population level burdens of loneliness, stress, and chronic disease. So, what is the ultimate impact of all this? When joy is intentionally designed into our systems, the effects are profound and measurable. First, well being rises, not just for patients, but for staff. An environment that prioritizes positive emotion is an environment that combats burnout and fosters resilience. Second, trust deepens. When an organization demonstrates that it cares about how you feel, it proves it sees you as a whole person, not just a case number. This trust is the bedrock of effective care. And finally, healing itself accelerates. A growing body of research in psychoneuroimmunology shows that positive emotional states can directly impact our physiological processes, strengthening our immune response and speeding recovery. Joy isn't just a feeling, it's a biological advantage. Here is the essential takeaway for every leader, caregiver, and designer. People will ultimately remember how you made them feel far more than the specific details of what you did or prescribed. This is a call to shift our paradigm, to move from a model of care focused solely on deficits, on what is broken, to one that is also asset-based, actively cultivating what makes us feel whole. So make joy part of the prescription. Make it a line item in the budget, a key performance indicator, a non-negotiable element of your design brief. Weave it into the very fabric of your systems, and then watch what happens. You won't just build better systems, you'll build a healthier, more connected, and more humane world. Imagine a future where our approach to health undergoes a fundamental revolution. A future where every hospital, clinic, and community center tracks not just symptoms and diseases, but a joy score, a real, measurable, and scientifically validated sign of our overall well-being. This isn't about ignoring the critical data we already collect. It's about adding a new, profoundly human layer to it. For too long, we've defined health by the absence of sickness. But what if we started defining it by the presence of joy? This single shift in perspective could change everything about how we design our healthcare systems, our communities, and even our own lives. It's a move from a reactive model of fixing what's broken to a proactive model of cultivating what makes us flourish. Picture a joy score like your Spotify Wrapped, but for well-being. The science is already clear. Joy is a powerful biological agent. When we experience genuine happiness, our brains release a cocktail of beneficial neurochemicals like dopamine, serotonin, and oxytocin. These don't just make us feel good in the moment. They actively counteract the corrosive effects of cortisol, the stress hormone linked to inflammation, weakened immunity, and chronic disease. Joy isn't a fleeting emotion. It's a physiological state that builds resilience, speeds up recovery, and can even extend our lifespan. So, if we know joy is this potent, why isn't it treated as a vital sign, as essential as our heart rate or body temperature? So how would we measure something as subjective as joy? The technology is closer than you think. Picture digital dashboards in a doctor's office, where moments of happiness are counted alongside blood pressure and recovery rates. This data could be gathered through simple, daily check-ins on a patient's phone, asking them to rate their mood or log moments that brought them a sense of purpose or connection. We could go deeper, using wearable technology to track physiological markers of positive affect, like heart rate variability. Artificial intelligence could even be trained to analyze vocal tone and facial expressions during telehealth appointments to provide a more objective assessment of a patient's emotional state. By combining self-reported data with these objective biomarkers, we could create a holistic and surprisingly accurate joy score for individuals and even entire communities. Now, consider the economic impact. What if hospital funding and public health resources were linked not only to survival rates and readmission numbers, but to the aggregate joy score of the populations they serve? Suddenly, the incentive structure for the entire industry would shift. Hospital executives would be asking new questions. Not just how can we discharge patients faster, but how can we ensure our patients leave not just treated, but genuinely feeling better, more hopeful, and more connected. This would transform the very architecture of care. Imagine waiting rooms designed with biophilic principles, filled with gardens, natural light, and calming sounds instead of sterile white walls and blaring televisions. Things? Picture music in the hallways, dedicated pet therapy programs, and laughter literally woven into care plans as a prescribed activity. Art and comedy would no longer be seen as frivolous extras, but as essential tools for healing, all because joy is now a key performance indicator. The environment itself would become an active participant in the healing process. Less Black Mirror, more Mr. Rogers, friendly, human-centered care. Let's extend this thought experiment to our personal finances. What if your insurance plan rewarded you for activities that spark joy? We're not just talking about a discount on a gym membership. Imagine earning wellness credits for taking a painting class, buying concert tickets, joining a hiking club, or even spending dedicated time with a therapist. Instead of just covering medications to manage a condition, your policy would proactively invest in your happiness to prevent that condition from ever developing. This is the ultimate form of preventative care. Of course, we'd have to design these systems with equity in mind, ensuring that rewards are accessible to everyone, regardless of income or location, perhaps through subsidized community programs and free public events. The goal isn't to penalize, but to empower everyone to seek out experiences proven to lift their spirit. Sound far-fetched? It's already happening in pockets around the world. In the UK and the Netherlands, pilot programs for social prescribing are empowering doctors to prescribe art classes, group walks, and mindfulness workshops, because robust research shows these interventions boost both happiness and physical health, often more effectively and cheaply than traditional treatments. In Japan, the practice of Shinrin-yoku, or forest bathing, is a nationally recognized form of preventative medicine. Even in the corporate world, forward-thinking companies are investing heavily in employee well-being, not just as a perk, but as a core business strategy to boost creativity, collaboration, and retention. So, what would truly change if joy became a metric we all cared about? The ripple effects would extend far beyond the walls of a hospital. We'd see a transformation in medical education with empathy, communication, and an understanding of social determinants of health becoming as crucial as anatomy. We'd build cities with more parks, public art, and spaces designed for community connection. We'd build systems that nurture the whole person, mind, body, and spirit, not just treat isolated problems. We would finally collectively believe that joy is not a luxury, but a vital sign of a thriving individual and a flourishing society. It's the metric that tells us if our policies, our technologies, and our communities are truly working for us. The first steps are ours to take. By starting conversations with our doctors about our emotional well-being, by advocating for community programs that foster connection, and by choosing to measure what truly matters. Together, we can begin to design, measure, and celebrate a future where joy is the ultimate indicator of our success. What if you could start making a difference today? Here's a challenge. Try a joy audit of the spaces where you give or receive care. Pause. Look around your clinic, your waiting room, your home. What sparks joy? What doesn't? Jot down your impressions. Snap a photo. Now imagine asking your health organization, what are we doing to make this feel better for everyone? It's a conversation worth having. Staff member, patient visitor, don't keep those moments to yourself. Share snapshots on social media. Share stories on social media. Spread inspiration. Show joy is possible, even in tough places. Here's your invitation. What's one thing you could change this week to add joy to someone's care journey? Small acts can make the biggest difference. Thank you for joining us on this journey. Remember, joy isn't fluff, it's function. And maybe it's time we design like it matters. But we're not done yet. Next episode, we'll be exploring how AI tools are being used to predict emotional states in clinical settings. Can machines measure your mood before your doctor can? Together, we'll look at the cutting edge of technology and compassion, where data meets delight, and artificial intelligence could help us create more human care. Stay tuned and don't forget, joy is everyone's business. Thank you for listening to Tomorrow's Consciousness podcast, where we explore the evolving intersection of humanity, technology, and the mind. Until next time, stay curious, stay conscious, and remember, the algorithm will see you now.